Bismillahirrahmanirrahim. Assalamu alaikum everyone. Quote of the day, the hadith, none of you truly believes until he wishes for his brother what he wishes for himself. Today, the topic of my presentation is occupational health and hazards. Learning outlines, introduction of occupational health services, occupational medicine, health of workers, occupational hazards, sickness, abstinence, prevention and control of occupational diseases, international regulations, conclusion, recent updates, and MCQs in the end. Learning outcomes. By the end of this presentation, participants would be able to describe the occupation health and hazards, their prevention and control. Now, what is occupational health? It refers to the potential risk to health and safety for those who work outside the home, and hazard is something that can cause harm if not controlled. Now, or occupational health can be defined as the study of the effect of work and the working environment on the health of the worker and influence of the state of health of workers on his ability to perform the work for which he is employed. Aims and objectives of occupational health are defined by Joint Committee of International Labour Organization WHO in 1950 as follows. Occupational health should aim at the promotion and maintenance of highest degree of physical, mental, social well-being of workers in all occupations, prevention among workers of departures from health caused by their working conditions, the protection of workers in their employment from risks resulting from factors adverse to health, placing and maintenance of the worker in an occupational environment adapted to his physiological and psychological equipment, and to summarize the adoption of work to man and of each man to his job. Preventive medicine and occupational health have the same aim, that is, the prevention of disease and maintenance of highest degree of physical, mental, and social well-being of workers in all occupations, level of application, health promotion, specific protection, early diagnosis and treatment, disability limitation, and rehabilitation. So, occupational health is application of preventive medicine in all places of employment. Functions of occupational health services: placing people in suitable work, maintaining people in suitable work, providing treatment, controlling recognized hazards, identifying unrecognized hazards, avoiding potential risks, screening for early evidence of non occupational disease, health education and safety training, surveillance of sanitary, catering, and welfare amenities, environmental control outside the workplace. The organization of an occupational health service and implementation of an occupational program to carry out these functions depends on main factors such as size and demographic location of the undertaking, extent and nature of the hazards associated with the work of undertaking, availability of resources, and relevant salutary requirement. Occupational medicine. In developed countries, occupational medicine has a special status within the general preventive medicine field. In their circumstances, it is not possible to maintain a separate status outside community medicine as we need to coordinate occupational health activities with the prevailing community health programs. The main responsibilities of a doctor working in industry are knowledge of the work environment, medical examination for general as well as occupational health surveillance, treatment services for illness and injury, health education, ability to access prevalence studies. Health of worker. Factors that influence the health of the population also apply equally to industrial workers, housing, water, sewage, waste disposal, nutrition education. Occupational health is to provide a safe occupational environment to safeguard the health of workers and to increase industrial production. Health of healthcare workers. Healthcare is the fastest growing sector, employing over in US sector, employing over 18 million workers. Women represent nearly 80% of healthcare workforce. Healthcare workers face a wide range of hazards on the job, including sharp injuries, harmful exposure to chemicals and hazardous drugs, back injuries, latex allergy, violence, stress. Although it is possible to prevent or reduce healthcare worker exposure to these hazards, healthcare workers continue to experience injuries and illness in the workplace. Cases of non-fatal occupational injury and illness with healthcare workers are among the highest of any industry sector. Now, occupational health, this is a manual for primary healthcare workers, and according to it, the Declaration of Alma Ata 1978, primary healthcare is the first level of contact of individuals, family, community with the national health system, bringing healthcare as close as possible to where workers live and work, and constitutes the first element of a continuing healthcare process. Workers are therefore an integral part in the body of declaration. In addition, the World Health Assembly has repeatedly requested member states to give workers' health a high priority in the overall program of work and to incorporate it as an essential component of primary health care. There are different levels of primary healthcare workers, doctors in charge of occupational health, dedicated healthcare personnel with background in general education, health assistants like nurses, health technicians, specially trained in occupational health, and qualified workers with vocational training backgrounds. Occupational environment. It is a sum of external conditions and influences which prevail at the place of work and have a bearing on the health of working population. So it is all about man and physical, chemical, biological agents, man and machine, and man and man. Now, the first component, man and physical, chemical, and biological agents. Physical agents include heat, cold, humidity, air movement, heat radiation, light, noise, vibrations, ionizing radiation. Factors act in different ways on the health and efficiency of the worker, singly or different combinations. Amount of working and breathing space, toilet, washing, and bathing facilities are important. Chemical agents decomprise of toxic dirt, gases, chemicals, which are potential hazards to the health of workers. They cause disabling respiratory illness, injuries to skin, deleterious effects on the blood and other organs of the body. Then comes biological agents. The workers may be exposed to viral, lichenial, bacterial, parasitic agents, and leading to close contact with animals or their products, contaminated water, soil, or food. Man and machine. Industry or factory implies the use of machines driven by power with emphasis on mass production. Unguarded machines, protruding and moving parts, poor installation of plant, lack of safety measures, they all are the causes of accidents. Working long hours and psychological postures causes fatigue, headache, disease of joints and muscles, and impairment of workers' health and efficiency. Then comes man and man. Numerous psychological factors operate at workplace. These are human relationships amongst workers themselves on the one hand and those in authority over them on another. Psychological factors, type and rhythm of work, work stability, service conditions, job satisfaction, leadership style, security, workers' participation, communication, system of payment, welfare conditions, degree of responsibility. These all come in this component that is man and man. Occupational environment of worker cannot be considered apart from his domestic environment. Both are complementary to each other. Ecological approach. Occupational health represents a dynamic equilibrium or adjustment between the industrial worker and occupational environment. Now, occupational hazards. WHO categorization of occupational hazards include physical, chemical, biological, ergonomic, psychological, and mechanical. Physical hazards. These include high temperature, low pressure, vibration, light, noise, non-icing radiation. Heat and cold. Common physical hazard in most of the industries. Direct effects are heat stroke, heat exhaustion, heat cramp. Indirect effects are decreased efficiency, increased fatigue, and enhanced accident rates. Occupational exposure to extremely low temperature experienced by divers, fishermen, dairy workers, refrigerator repairmen. Important hazards associated with cold works are chill winds, trench foot, and frostbite. General hypothermia is common. Workers may be exposed to risk of poor illumination or excessive brightness. Acute effect of poor illumination as eye strains, headache, fatigue, eye pain, lacrimation. Chronic effects are minor nystagmus, exposure to brightness or glare, discomfort, annoyance, and visual fatigue, intense direct glare, blurring of vision leading to accidents, sufficient suitable lighting, natural and artificial whenever persons are working. Noise. Noise is a health hazard in many industries. Auditory effects include temporary or permanent hearing loss. Non-auditory effects include nervousness, fatigue, interference with communication by speech, decreased efficiency and annoyance. Degree of injury depends on intensity and frequency range, duration of exposure, and individual susceptibility. Vibration, the frequency range of 10 to 500 hertz tools such as drills and hammers usually affects the hands and arms, and after some months or years of exposure, fine blood vessels of the finger may become increasingly sensitive to spasm. Exposure to vibration may also produce injuries of the joints of hands and shoulders. Ultraviolet radiation, occupational exposure to ultraviolet radiation mainly affects the eyes, causing intense conjunctivitis and keratitis. Symptoms include redness of eye, pain, usually disappear in few days with no permanent effect on the vision or on the deeper structure of eye. Then comes ionizing radiation, increasing application in the medicine industry, for example, X-rays and radioactive isotopes. Tissues like bone marrow are more sensitive, hazardous to genes when the gonads are exposed. Radiation hazard, genetic changes, malformation, cancer, leukemia, ulceration, sterility, and extreme cases can cause death. The International Commission of Radiological Protection has set the maximum permissible level of occupational exposure at 5 mg per year to the whole body. Then comes biological hazards. Workers exposed to infected and parasitic agents at the workplace may cause brucellosis, leptospirosis, anthrax, hydatidosis, tetanus, fungal infections. Persons working among animal products and agriculture were especially exposed to biological hazards. These are the different biological hazards you already know. Then comes chemical hazards. Chemical hazards in various occupations can be due to gases, vapor, fume, mist, dust. Risk associated with occupational exposure to gases was first shown in mines. Gases can cause damage due to asphyxiation, irritant action, toxic action, necrotization. Gases that cause occupational health hazards are asphyxiant gases, irritant gases like ammonia, chlorine, sulfur dioxide, toxic gases, and inert gases. The chemical hazards can be due to local action, inhalation, or ingestion. Local action. It caused dermatitis, eczema, ulcer, cancer by primary irritant action, inhalation due to dust, gases, metals, and their compounds. The dust are finely divided solid particles ranging from zero point 0.1 to 150 microns. Larger than 10 microns settle down from the air rapidly. Indefinitely, particles smaller than 5 microns directly inhaled into the lungs and are retained there, and it may be responsible for pneumoconiosis. So dust can be classified in organic and organic dust or soluble and insoluble dust. Gases, there are simple gases like oxygen, hydrogen, asphyxiating gases like carbon monoxide, anesthetic gases like chloroform, ether. Then comes metals and their compounds like lead, antimony, beryllium, cadmium, zinc, chromium, and phosphorus. Ingestion, occupational diseases may also result from ingestion of chemical substances such as lead, mercury, arsenic, and zinc. Mechanical hazards. Then comes psychological hazards. The factors that affect health like frustration, lack of job satisfaction, insecurity, poor human relationships, emotional tension. The health effects can be classified into psychological and behavioral changes, psychosomatic ill health. Then comes ergonomic hazards. What is ergonomics? It means fitting the job to the worker to achieve the best mutual adjustment of man and his work for the improvement of human efficiency and well-being. Application of ergonomics has made significant contribution to reducing industrial accidents and to overall health and efficiency of the workers. Goal of an ergonomic is to reduce work-related musculoskeletal disorders. Other terms for this is accumulative trauma disorders, repetitive strain injuries, overexertion injuries, and overuse syndrome. WHO uses the term work-related musculoskeletal disorders to characterize disorders that involve both personal and work-related factors and distinguishes them from occupational diseases where entire causes by work exposure. Occupational hazards, in short, physical, biological, chemical, ergonomic, psychological. We have already discussed that these are the physical factors. These are the biological hazards. In ergonomical, there comes manual handling, repetitive movement, restrictive working area, and psychological job stress, job monotony, unsocial hours, and job organization. Now, occupational diseases. First comes pneumoconiosis. It is a special type of chemical hazard produced by occupational exposure to dust, characterized as major pneumoconiosis caused by silicosis, asbestosis, anthracosis, and minor pneumoconiosis, which is basilosis, bicyanosis, and farmer's lung. Then comes occupational cancer. It is a serious problem in industry. The sites of the body most commonly affected are skin, lung, bladder, and blood-forming organs. Characteristics of cancer appear after prolonged exposure. Period between exposure and development of disease may be as long as 10 to 25 years. The disease may develop after cessation of exposure, and localization of tumors remarkably constant in any one occupation. Control of industrial cancer. Elimination or control of industrial carcinogens. Technical measures like exclusion of the carcinogen from industry, well-designed machinery, closed system of production, etc. It all includes medical examination, inspection of factories, notification, licensing of establishments, personal hygiene measures, education of workers, and management research. Occupational hazards of agricultural workers, it is a new concept and it has a multitude of health problems affect which is often forgotten because of the widespread misconception that occupational health is mainly concerned with industry and industrialized countries. The hazard to which a worker in agriculture activities exposed are physical hazards, chemical, biological hazards, and accidents. Accidents in industry. Accidents are more common feature in most industries. In fact, some industries are known for accidents. For example, mining, especially coal and construction work. It was estimated that nearly 3 million men are lost yearly due to industrial accidents. Causes are human environmental, physical, physiological factors, psychological factors. Environmental factors are the temperature, poor illumination, humidity, noise, unsafe machines. Unsafe machine account for 10 to 20% of all accidents. Sickness abstinence. It is important health problem industry as the production techniques become more sophisticated. Abstinence tends to increase. It is a useful index in industry to assess the state of health of workers and their physical, mental, and social well-being. Causes, economic causes, social causes, medical causes, non-occupational causes. Prevention and control of occupational diseases comes medical measures, safety or engineering measures, and legislative measures. Medical measures, pre-placement examination, periodic examination, medical care services, healthcare notification. Engineering safety measures include design of building, good housekeeping, general ventilation, mechanization, substitution, enclosure, dust, isolation, local exhaust ventilation, protective devices, environmental monitoring, statistical monitoring, research. Hierarchy of control. Here we can see that from going from top to the bottom, here it is most effective, going down towards the least effective. First comes elimination. It physically remove the hazard. Substitution. It replace the hazard. Then comes engineering control. It isolate people from the hazard. Then comes administrative control. It change the way people work. PP. It is personal protective equipment. It protects the worker with personal protective equipment. Then comes legislation. Before devolution of 2010, labor policies were made by Ministry of Labor, but after devolution by provinces. National laws made before devolution, these were Punjab Factories Rule 1978, Mines Act, Provisional Employees Social Security, Workmen Compensation Act, Labor Policy 2010. Provisional laws after devolution, number of different acts have been made in all provinces. It includes Workmen Compensation Act in Sindh and KP, Employee Social Security in Sindh. All provinces have devised factories rule under Factory Act 1934. Comprehensive labor policies in two provinces, that is Sindh Tripartite Labor Policy and Punjab Labor Policy 2015. Child labor laws. According to International Labour Organization UNICEF, if work is not affecting health and personal development as well as schooling of children, for example, assisting in family business, working in school holidays and after school hours, then it does not fall in child labor. So it is just termed as child work. Pakistan Employment of Children Act 1991. Provinces have made prohibition of employment of child act in 2015 in KP, 2016 Punjab, 2017 Sindh, Balochistan has a draft act. So that is Pakistan Labour Policy 2010. Overview Punjab, this is Punjab Social Security Institution. It is an autonomous body under the administrative control of Labour and Human Resource Department under Punjab Government Rules of Business 1974, established to provincial employees. Provision of health facilities to the workers and their dependents covered under the provincial social security laws. Provincial Employees Social Security Ordinance requires employers to contribute 6% of the wages of their employees having wages up to rupees 22,000 to the Punjab Employees Social Security Institution. Medical facilities include comprehensive medical treatment, social security hospitals and facilities not available in social security hospitals are arranged to other hospitals at the cost of Punjab Employees Social Security Institution wherever those people are available. In case the required facilities are not available within the country, the same are managed abroad to cater to the health requirements of secured persons. Cash benefits, sickness benefits, injury benefits, iddat benefits, maternity benefits, gratuity, disablement pension, survivor pension, artificial parts, funeral grant, financial assistance, free education of secure workers, children. So these all are the benefits that are given by social security programs. Then comes Social Security Islamabad. It provides healthcare facilities and cash benefits to secured workers and their dependents working in industries or commercial establishment in Islamabad. Then Pakistan Occupational Health and Safety Act to 2018, an act to ensure safe and healthy working conditions for the people at work by authorizing enforcement of the rules and regulation developed under the act, by assisting and encouraging the organization, institution, and geographic areas governed by the federal government in their efforts to ensure healthy and safe working conditions by providing for research, information, education, and training in the field of occupational health and safety. Then comes Swiss cheese model. The Swiss cheese model of accident causation, originally proposed by Jam Reasons, likens human system defenses to a series of slices randomly hold Swiss cheese arranged vertically and parallel to each other with gaps in between each slice. Uh, so these are the slices that serve as barriers, and the holes represent that the hazards that are losing from it. So reasons hypothesize that most accident can be traced to one or more of the four levels of the failure. At organizational, there are the four levels that organization influences unsafe supervision, preconditions for unsafe acts, and the unsafe acts themselves. In the Swiss cheese model, organization defenses against failure are modeled as series of barriers represented as slices of the cheese. The holes in the cheese slices represent individual weaknesses in the individual's part of the system and are continually varying in size and position in all slices. The system as a whole produces failures when holes in all the slices momentarily align, permitting a trajectory of accident opportunity so that a hazard passes through holes in all of the defenses leading to an accident. As we can see here that all the holes are aligned and there is a loss of the hazard through this. This is called trajectory of accident opportunity. International regulations, these are OSHA guidelines and Global Plan of Action on Workers' Health. OSHA, Occupational Safety and Health Administration. It is an agency of U.S. Department of Labor. It was created by Congress. Its mission is to prevent work-related injuries, illness, and thus by issuing and enforcing rules for workplace safety and health. OSHA regulation provides hepatitis B immunization to employees without charge within 10 days of employment, require that a universal precautions be observed to prevent contact with blood and other potentially infectious material. Implement engineering controls to reduce production of contaminated spatter, mist, and aerosols. Implement work practice control precautions to minimize splashing, spatter, contact of bare hands with contaminated surface. Provide facilities and instruction for washing hands after removing gloves and for washing skin immediately as soon as feasible after contact with blood, potentially infectious materials. Prescribe safe handling of needles and other sharp items. Prohibit eating, drinking, handling contact lenses in the contaminated environment. Ban storage of food and drinks in refrigeration or other spaces where blood or infection material is stored. Place blood in contaminated specimen to be transported, stored into suitable closed container to prevent leakage, and then as soon as feasible after treatment, attend to housekeeping requirements including floor sinks that are subject to contamination. Provide written schedule for cleaning contaminated shafts are regulated waste discarded in hard wall containers and place reusable contaminated shaft instrument into a basket in a hard wall container for transportation to the cleanup area. The second one is Global Plan of Action on Workers' Health 2008 to 17. This plan links occupational health to public health by identifying the following objectives for global action: to devise and implement policy instruments on workers' health, to protect and promote health at workplace, to improve the performance and access to occupational health services, to provide and communicate evidence for action and practice, to incorporate workers' health into other policies. So conclusion is that the occupational hazards are present in every profession. With advent of advanced technology, no matter how beneficial it is, can exert a negative impact on some members of the population. The reality is to balance, maximize benefit and minimum harm to the population and well-being. Once identified and recognized as risk, new guidelines, protocol should be rapidly instituted to reduce or even eliminate the hazards. Application of ergonomics and administrative measures contribute greatly in reducing the occupational hazards in professional group. Now, coming to recent updates, Government of Pakistan Labour Policy. Since creation of Pakistan, five labour policies have been announced by the government the year 1955, 59, 1969, 1972, and 2002. After 2002, no labour policy has been introduced, and although a number of developments took place in the intervening period, of all the previous policies, the labour policy of 1972 taken out was the most progressive one, which reformed the labour laws and set out benchmarks. The government vision for the new labour policy contained enriched in the four main guiding features. Labor policy, like policy in other fields, should also aim at attaining objectives in a manner best situated to the resource of country and the present state of economy. The labor policy has accordingly been divided into four parts: legal framework, advocacy, rights of workers and employees, skill development and employment, manpower export. Now, this is a systematic review which confirmed a positive correlation between hazards, that is physical, chemical, and psychosocial, and work-related injuries, occupational health problems, and work-related diseases. The burden of disease and attributable fraction of work-related disease and occupational injuries have been shown to cause considerable social and economic losses for employees, families, companies, countries, and societies at large. Generally, the burden of disease assessed using disease and adjusted life period. Burden of disease measured as the impact of morbidity and premature mortality within a given area. And 269 scholars and professionals agree that reducing, substituting, or eliminating OSHA hazards in occupational health service hazards in healthcare facility important for healthcare workers helps to ensure patient safety and enhances the overall quality of healthcare. Many researchers have used the hierarchy of control, which based on the assumption that intervention are most effective implemented at the source and least effective when applied at the worker level. Now coming to MCQs. MCQ number one, factory worker in different types of factory exposed to different hazards. Handling of dangerous tools is an occupation in an occupation can be classified as physical hazard, chemical hazard, biological hazard, mechanical hazard, psychological hazard. Anyone? D is the right option. That is mechanical hazards. MCQ2, administration of the hospital XYZ is very much concerned about the safety and health of the healthcare worker. Most prevalent occupational health hazard to a health professional is hepatitis B, AIDS, malaria, tuberculosis, pneumonia. A is the right option, hepatitis B. MCQ number 3, management authority of the city XYZ allocated to task to do amendment to reduce the air pollution, to reduce lead elimination from automobile in the environment. The best way is legislation, environmental monitoring, dust separation, substitution, law implementation. D is the right option.
D.
Substitution.
D.
D. Research team in the XYZ city were working on a project to find out the effect of heat on factory workers. Heat exposure is found in following industries except steelworks, foundries, boiler house, slaughterhouse. Um, D is the right option, that is slaughterhouse. MCQ number 5, factory worker came to the hospital complaint of a issue in hearing from last 6 months. Best expect for prevention of noise-induced hearing loss in factories is enclosing noise source, use earmuffs, use less fiber material, enclosing apparent soundproofs, boost, changing
D.
department. B is the
It's
right
B.
option. Yes. MCQ number 6, in chemical factory management has designed all precautionary measures for the safety of the worker. Most common form of skin involvement in this occupational setup is punctate ulcers, irritant contact dermatitis, painful burns, folliculitis, eczema.
B.
B is the right option. MCQ number
B.
7. Management of factory XYZ has provided all health facility to a worker because they are concerned about workers' well-being. Indicator of health status of workers in an industry is accident books, recovery or treatment care cost provided, daily attendance record, clinical records of workers, off days from work.
D.
Yes, right.
D.
MCQ number 8. Pre-placement examination ensure that your prospective employees can safely perform the job they are applying for. One of the statement about pre-placement medical examination is not true. It is done to assess the fitness of a person for a specific job. Conducted only on those who are concerned with public safety. Used for record keeping. Gives baseline information of health. B is the
B.
right option, yes.
B.
MCQ number 9, industrialization plays very important role in the economy of any country. Main aspect of preventing occupational health hazard is control of recognized hazards, screening of diseases, health education and safety training, environmental surveillance, provision of personal protective equipment on paid
E.
basis. C is the right option. MCQ number 10. ILO, whose mandate is to advance social and economic justice through setting international labor standards. The main objective of ILO about occupational health is promotion of well-being, protection of workers, placing of workers in appropriate place, providing treatment to workers, ensuring social security of workers.
E.
Yes, right. This is the key of MCQs. This is the YouTube link of presentation, and thank you.